A local doctor is qualifying patients for medical marijuana without meeting them in person.
The telemedicine doctor is advertising the service for just $200. Investigative reporter Chris Negus asked the doctor how he determines whether a patient is being truthful and discovered a few things the doctor doesn't want to talk about.
It starts with a generic flyer. Schedule your appointment at mogreencare.com. No names, just a number and an address. So a News 4 producer checked it out.
Good morning, Ms. How are you?
On the other end of this internet connection, Dr. Michael Zera. For $199.99, he schedules an online appointment to get people signed up for a medical marijuana card.
My name's Dr. Zera, and I can certify you for medical marijuana. Do you know what your qualifying condition is?
Our producer said knee pain from childhood, which is true. She still gets around just fine, but sometimes she says there's a little pain.
Well, chronic pain is one of the qualifying conditions. That should be no problem.
Without reviewing any medical records from our producer's doctors, she got the green light. So we called the doctor to ask him questions about his process, and he agreed to sit down with us.
The consultation that you guys had lasted about a minute. Is that typical?
It depends on if the patient has a lot of questions.
Dr. Zera isn't the only doctor signing up patients. A News 4 investigation in September showed you Dr. Zinnia Thomas's cannabis tour.
So congratulations, everybody. You're legal. Go take your medicine.
People paid $100 to see the doctor. Thomas signed people up in mass, sometimes a dozen at a time, after filling out a short questionnaire where patients were told what score they needed to achieve to get qualified.
Excellent.
Those patients left with paperwork claiming they suffer from a debilitating psychiatric disorder.
So yay, everybody's qualified.
Dr. Thomas did not perform one-on-one exams and did not talk to every patient. In the case of Dr. Zara,
Any questions for me?
he did speak directly to the patient, but not in the same room. This meeting was over Skype.
How do you know the person actually has the condition they're describing to you over the internet
That's all the information I need from you.
when you're not able to actually see them in person and do a self-exam?
I just assume people are providing accurate information.
Is there any concern that they may not be?
The doctor thought about it for nearly a minute, but didn't have much of an answer.
I have to think about that.
You should get
Given what we've seen, we wanted to know how the doctor justifies the price, and whether he or other doctors should even be necessary.
Do you think a doctor should be part of this process? Some states, recreational marijuana is allowed. You go to Colorado, you just walk into a store, you get it. Do you think Missouri should go that route, or do you think a doctor should be a part of this process?
I think if you're using marijuana as medicine, a doctor should be part of the process, yeah.
For critics, though, for people that see this and they go, wow, he's charging $200. It's not a lot of work. It looks like a huge profit for a few doctors.
The prices that we chose were what we've been told other states have, other states who have had medical marijuana programs have been charging. That's where we got the price.
When we first spotted Dr. Zera's flyer, we didn't know anything about him. A quick online search revealed something we did not expect. Although licensed in Missouri, his license to practice medicine in Illinois is suspended.
Why is that?
I don't think I'm going to do this anymore.
Well, I mean, we'd just like to find out why it's suspended in that state. Is that not a fair question?
No.
According to state records, he received a DWI in Ohio, and while on probation, his breathalyzer tested positive for alcohol. In Illinois, he was prohibited from prescribing mood-altering drugs to himself, family, or friends.
Doctor, anything else?
Several hours later, Dr. Zara emailed our producer to apologize for abruptly ending the interview. He said he developed a drinking problem during a divorce, but never drank at work. As for his probation violation, he said it happened after he drank 3 beers and it only happened once. He says he's in recovery. Dr. Zara told me he signed up between 60 and 70 people. So what do you think? Given the ease of getting people signed up, should you be required to pay a doctor a couple $100? Or would you favor what Illinois is doing and remove the word medical and just make marijuana open to anyone? Let me know on my KMOV Facebook page. Chris Nagus, News 4 Investigates.